everyone, and welcome to another session of the Fond du Lac Area Women's Fund's Project Table Talk. I'm Maria Turner, the Executive Director, coming at you with co-facilitators Kyle Jefferson and Aaron Flood, who are both members of our Board of Directors. And today we are welcoming two guests, Kaitlyn Kenealy and Keziah Love. They are both our 2022 Women of Achievement. Coming up here, we're going to recognize them at our upcoming Power of the Purse event. And we will be focusing that event surrounding mental health, because both Keziah and Kaitlyn happen to also be therapists here in the Fond du Lac area. So we thought it appropriate leading up to the event, and also just with the circumstances surrounding our world these days, that we set aside several programs specifically dedicated to conversations about mental health. So today's topic is going to center around what? The pandemic, right? COVID and the impact COVID has had on pretty much everyone's mental health at some level. So we wanted to start a little bit about telling you why, this is important, other than, the fact that everybody's been affected in some way. We also found in a collaborative survey we did last year, looking at COVID's impact on women in Northeastern Wisconsin, collaboratively with the other three women's funds from Green Bay, Fox Valley, and Oshkosh. We found that women were particularly affected by the pandemic. To give you some idea of what that survey showed. So 70% of women felt their mental health plummet during the first year of COVID. Now, certainly we did this 1 year after COVID had arose in this area. And unfortunately, almost another year later, we are all still dealing with it. So I can imagine that plummeting has not probably rebounded yet. And maybe it's even gotten worse, which, Keziah and Kaitlyn, we're going to look to you to provide some insights into that. Additionally, 31% of the women taking that survey reported that they had used prescription medication over the past year leading up to that survey. And 54%, this is concerning to me, said that they delayed getting medical care during the pandemic, including counseling from mental health professionals, because availabilities of appointments just weren't there. So some staggering findings from that, which is sort of to set the stage here for this conversation. And let's start with just finding out a little bit from each of you, Keziah and Kaitlyn, if your experiences within your practice since the pandemic began in 2020 support the findings of our survey. Are you finding women are more stressed and having difficulties that they might not otherwise have experienced before COVID? So Keziah, let's start with you.
Yes, I would definitely agree with that. A lot of women that do come to me have stated that they have tried everything. So one of the steps is normally their primary care physician are the ones to be able to prescribe depression medication, anxiety medication. And then they're finding that it doesn't work, or they're just impatient to sit with that and have the time for it to really dissolve in their bodies, and their bodies get used to it. And so they also try other forms of things that will relieve their stress. So such as, women to say, I joined certain groups like from churches, or finding a Zoom meeting with women that are in the same shoes that they're in. And nothing is really working because they're still having to deal with the issues at home. So now with the pandemic, there's a delay in child support. Some women come to me saying that was their only source of income, and then trying to go get W-2 services. And so they're trying to reach out and take care of all the things that will keep a roof over their head and food in their homes. And then they get to a point where they just break. So women wait until symptoms really get really bad for them, because they're really out trying to make things happen. Women carry weight, women carry discomfort. They can carry symptoms for a long time, longer than men. Why? When you think of it, when we have children, and most of these women that are coming to me are mothers. And so they're trying not to break in front of their children. They're trying to be that strong vessel and make things happen. They're trying to keep everything together, right? So women are relational beings. I think about the piece of just being mothers and how they try to carry everything for everyone and everybody. They try to show up for everyone and everybody. And it's almost to the point when they're focused on everyone else, they lose themselves to the point where they break. And then they're in my office or applying somewhere else, right? And I think what happens is that the availability of services is there. But when they get ready to break, they're looking, now it's like a panic, right? It's a panic, like I need somebody right now. And so they're saying we got room. It might be June, but we can't get you in until October. And they're like, no, I need it, and I need it now. And so I think that's what's happening, is that women are waiting to the point where availability for therapists like me is open. And oftentimes when there is a crisis that do come in, we got support staff that will say, hey, we got somebody that's been struggling for this long, and we just need someone to see them. It will anybody open up their schedule. So sometimes there's if there's a will, there's a way. But other times it comes to the point where the women are just like, no, I need it now. I've been dealing with this and I need help. The medication isn't working and I just need someone to talk to.
Mm. Kaitlyn, what has been your experience?
Oh, that pretty much summed up a lot of it. So I'll just
Similar,
freaking
yeah.
piggyback off of it. So the way that I think about it is the pandemic for me and the patients that I see have really come in phases. Right now, I feel a new phase is actually men. I have gotten more referrals for males than I have like ever. So I would say that they are starting to reach out. We are seeing some of that. But what has been happening, absolutely symptoms, kind of like what Keziah was saying, are unmanageable because of all of the external factors that are going on. And so we have had to get very creative, right? Whether it has been, hey, here's this workbook that I'm providing for you, right? Can we find a group? Can we find coaching? So we've done different things to try to get people along the way, especially the barriers, though, when it's coming to insurance and providers and different even wait lists for services that would pertain to medication and all of that. So it's really been me trying to be like, okay, we'll get on every wait list that you possibly can, right? How can we kind of manage what's happening right now while we're still working towards the future of what that might be? And then what can we do to get creative to manage those symptoms if the medication isn't working, if we can't find a babysitter, right? How about you bring them in, right? It's not going to be the most effective therapy session in that regards, but if that's what you need, then that's what we need to do. So that's what I would say to piggyback off of what Keziah said. But yeah, pretty much everything she said is exactly what I'm dealing with as well. Mm-hmm.
Ladies, a lot of what I'm hearing you talk about is that at this stage of the game, women are feeling pretty helpless. And I know sometimes, unfortunately, when you feel like you've done everything, you've worked every plan, you know how to work, you've reached out, which we all know how hard it is sometimes to ask for help. So you've even been willing to go and ask for help and feel like you're hitting roadblocks even when you do that. Unfortunately, and statistically, people often turn toward other self-destructive forms of comfort or numbing when they can't get the help that they really need. And so, in my mind, when we were preparing for this, I really wanted us to talk about the incidence of drug and alcohol abuse and what you've seen, as a possible increase from the pandemic. Kaitlyn, can you speak to that at all?
Sure. So I'm not AODA trained, right? So when that specifically happens, then I have to work to help them find a provider or an institute or a setting that is going to be conducive for that. But I will say that negative coping has been extremely prevalent, right? So what started before maybe every once in a while has increased. So those referrals, when it pertains to specifically drug and alcohol, I've had to make more of those and again, work with people people. So maybe I can help be that buffer in between. We can do a little trauma work or, symptom reduction. But if your primary concern is alcohol and drugs, then we have to figure out who's going to be the best provider, what's going to be the best fit. And I've had to do that more than I've ever had to do in my entire career. And then a lot of different negative coping because of the symptoms. So it might not be that they turn to drugs and alcohol, but it could be, negative relationships or negative different behaviors that they're picking up on, that maybe they thought prior they kind of had a grip on or it wasn't an issue, but now have extremely become amplified within this environment because there's no way to kind of handle it properly. But what I would say is, all in all, there is a lot of negative, but I would say this is that me also being in the pandemic and going through it with them, right? Like it's not the same story, but I would say like, hey, I'm in this with you. I'm also in the pandemic. I don't have the specific answers, but we're in this together. And that has been clutch. Like, okay, it's put us kind of on the same playing field. And so that is something that I would say that's kind of beautiful that has come out of this in my professional realm of things. But yes, amplified behaviors and negative coping. And then, so I don't know, Keziah, if you had more insight into that.
No, that was awesome.
Yeah, thanks, Kaitlyn, for that, for sure. You kind of think about like drugs and alcohol, and 2020 been just a rough time for all of us. I actually can kind of piggyback on that part of like the alcohol part. Definitely found myself in a very uncomfortable spot of not being able to coach and help kids and not being able to do the things that I was used to doing. So, one of the ways was I coped in a very negative way, like you said, turned to drinking. I think, if I'm not mistaken, I think I polished off a bottle a week for like at least for 4 months. Right. And so you kind of think of that, and you're not really understanding what you're doing, and I also have a little guy that's around. So I'm not being very responsible just because of the pandemic and how it affects me. It also turned me away from, for kids too, right? So I was so used to being around kids and having an impact, and not being able to have that bond with them was also, hurt myself, and it hurt a lot of kids because they would reach out to me and says, hey, coach, what can I do? Are we going to have a season? Are we going to have this and that? And for me to sit there and be, I would say, kind of hopeless in a way, and not be able to say we are going to have a season. And I'm always saying that they're talking about it and not having a true answer definitely made a difference, right? I saw a lot of kids kind of lose sight of what was in front of them. Which is kind of bringing me to my next question. Please, is it Keziah? Keziah, thank you, Keziah. Keziah, quick question for you. So can you kind of speak about that, like the daily lives of young athletes in the school system, and how, curricular activities plays a huge role in their mental stability?
Oh, yes, absolutely. I think about the number of children that I do have on my case, and it's a big load. And what happens is that children, it seems like they have become very overwhelmed. You think about how we have gone from this normalcy to now creating a new norm, and going from virtual to then in person to wait, nope, numbers are skyrocketing. We're back, home now. And it has created this unbalance just amongst our children. So there's a disruption in routine, right? So the routine that our children have gotten into has been broken. So those broken routines and the disruption in the routines have created the symptoms of depression, anxiety. They begin to feel the joint pain. There's a lack of attention and focus, concentration. economic hardships, as well. So here it is, kids want to do certain things. I have children say, yeah, I can't do ballet anymore because mom and dad doesn't have the money or the funds to keep that up. And so then there's also the part of a lot of my children have lost their parents in the pandemic as well. And so you got that. And so I believe it was a statistics that said 43%, or I would say 43,000 estimated that children, now this is with the Black children, being disproportionately impacted by a parent from a loss. So these children who are Black, 43,000 have been impacted by a loss of a parent. And then when you think about being at home with the parents, there's this social attachment as well. So pandemic, they've been home so long, they're used to mom and dad or just mom being there. Now when mom has to call the babysitter to go, the kids are like, wait, what you doing? I just know you. I know to be at home with you all this time. And then when it's time to go to school now, the children are going to school with stomach pains, again, the pains, and they're feeling like that anxiety is actually rushing up, it's coming up, and they just don't know how to socially disattach themselves from their loved ones. And more than likely, it's always the parent. Then when you think about coming into the school, the mask, right? And it's just like, I want to be able to see you. I want to be able to also see your lips. I have a lot of students that have hearing, issues, and they're frustrated because most of the time they're able to understand by reading your lips. And now we got little kids having to wear masks and they can't see what their teacher is saying. So that's another part. Then there comes the defiant behavior, being so defiant that they don't want to listen. And again, this is all because of everything that has built up with them, and they don't know how to now emotionally express themselves. So now there's a decrease in being able to express themselves. They only can show the anger. They don't want to show the gentle side anymore. They just know how to pop, snap, crackle, and pop. And so with the decrease in the exercise tolerance, it's just that lack of energy, even the schoolwork. Children are really struggling. Almost every child that come to me, they'd be like, yeah, I'm still behind in my work, but I did get caught up on this assignment. It's things like that, but it's a decrease all around because they aren't there mentally. They're actually trying to catch up. So it's just like, okay, I got 50 missing assignments, but then also now I went to school for another week. So now I got 10 extras added on. They could never catch up. I was reading another statistic, and it was talking about how children are less likely than adults to be affected by the severe symptoms. So this is like the severe symptoms of the pandemic in terms of the physical symptoms. So when you think about just how the adults get sick and things like that, most children are asymptomatic. They don't really have all of that. But there are studies that's showing, and I'm seeing it, that there's a lasting adverse effect on their mental, physical, and socio-emotional development. And that's where the struggle is. And then being able as a therapist to work and to navigate through all of that to get them back on this path of being able to handle routines that are no longer a routine, but there can be disruption at time. And so trying to get our little ones, our high school individuals on the track of really being healthy mentally first.
Oh my gosh, where do I start with all of that? So I'm a mom. I'm a mom
it's a lot. It's a
two-
lot, but it's
of-
real. It's
yeah,
all real. You know what I mean? Like it's not just a one prong approach. I mean, everything, where school used to be the environment where they would be safe and they would kind of maybe escape what was happening at home.
Right.
That is no longer the case,
Yeah.
so there's just so many different layers.
Yeah.
Absolutely.
So I'm a mom of two girls. They're older, and so the thought would be they're able to cope perhaps a little bit better than young kids. However, that's the longer amount of time they've been used to school as a routine, right? So what I saw with them was a lot of what you're talking about, like they were troopers. One's in college. Boy, talk about messing up her freshman and sophomore year of college, right? Like, you have these expectations when you go off to college about making friends and being in a different setting and blah blah blah, and the pandemic just wiped all of that out for her. So she was a trooper. She has rebounded from that, thankfully. And then my other daughter is a junior in high school, and she too, she has difficulties, has had some learning disabilities along the way. And for her not to have that one-on-one physical contact in a classroom with a teacher, oh my gosh, like, she just was beside herself. Like, and she's very, wants to do well. She's very, is always wanting to excel at what she does, and just was struggling, right? So I get it. One of the other things that you talked about, Keziah, that I have been really reflective about is this messaging that children are getting related to masks, and like yellow caution tape on. I remember I was sitting in an eye appointment waiting room with one of my daughters, and like, they had this caution tape around every other chair, right? Because it was social distancing. Everyone's wearing masks, right? And I am just sitting here like, wow, here are two examples of what we have always attached to crisis, emergency, bad things, caution, stay away, masks, oh my gosh, and I'm like, there's things that I think people are internalizing subconsciously just based on what we've attached meaning to related to masks and this yellow caution tape and all of these things that we're not even probably aware of the impact of that, right? And at some point that's going to show up for all of you,
we haven't even seen the systemic effect. Like,
right.
So the things that you're talking about, absolutely, but the systemic effect and what is going to happen, like, I don't even think we're at the tip of the iceberg right here.
I agree.
And so absolutely, if we needed to buckle up when this thing started, I'm gonna need to buckle up and have like extra straps on or something moving forward.
Years and years from now. So let's talk a little bit about that. I don't know that it's necessarily systemic, but one of the other things I've observed is everyone's reaction to the pandemic when it comes to the concept of fear. Right. And so I personally am someone that is less fear averse than most. I mean, I've skydived. I love roller coasters, like, I'm out there. So I can't really base everyone else's fear against my own, because I do realize that I'm more of a risk taker than most. However, it's been just really interesting to me, this idea, and I get it, people are dying. I don't want to minimize the fact that there are people dying, and that is something to be afraid of. However, people die every single day of, all kinds of things. We get in the car, we are taking our life into our hands, and we don't have control over that. So it's been really strange for me to wrap my head around this idea of fear related to the pandemic. So Kaitlyn, let's talk a little bit about that, like people's association with fear from a psychological standpoint, and why COVID might be heightening that relationship for some folks.
Yeah, I mean, first of all, what I want to say is I don't blame people. I think the messaging was so messed up that there's so many layers to it. How could we not be fearful when we look at social media? What happened? This, stay home. we had never experienced those things before, right? And so I think that messaging and that the cycle of that just keeps happening, because I keep being like, all right, well, we've been in this 2 years now, what can we figure out? But that's also me not being in panic mode and being able to look forward or look further beyond. But what happens, when we're in fight or flight mode, right? We can only think short term and in this moment. And I think that that's what's happening to people, is they're so afraid because of the messaging, because of the symptoms, because, work environments have changed, right? Schools have changed. Everything that we had before that potentially we took for granted, right? Never having to think about that before, really all became amplified. And then that messaging on top of everything else. And then I think the biggest thing is, well, when is this going to end? When is this going to return back to normal? And so that's what I was talking about before, about the phases of this pandemic. In the beginning, we could say like, okay, it's good. What, 3 weeks? 2 months? Okay, yeah. 6 months? You know what I mean? So like giving people, and I think that what's the opposite side of fear is hope, right? And so we're going to hope it gets better. We're going to see these things, and that keeps dwindling over time, which makes fear stand where it is. And when we are in fear, when everything around us has that, we can only think short term because we are in survival mode. We cannot think long term. I need to figure out how to feed me, my family, reduce these symptoms, get through the day. I can't think about 6 months from now. So I can't wait, Kaitlyn, for services. I can't be on all of these wait lists because I need to survive today. So until we can start shifting that narrative and move from survival mode into thriving or, a new normal, we're going to be continuing to be in this cycle of fear, because that's kind of what happens to us psychologically.
Absolutely.
Mm-hmm.
Everything you just talked about is so powerful, both of you. I'm so grateful for this conversation. Because I think there are a lot of people sitting in their homes right now who wonder if they're the only one that feels this way, right? Especially when you're a worker, you're an achiever, you're I got this. When you're, we brought up just Keziah, you explained so beautifully, like what it feels like to be a mother, what you carry when you sign up for this job, right? And so one of the things that we are interested in talking about at the Women's Fund are issues that disproportionately affect women and children, which, from everything that you both have said, COVID is one of those issues. Can you tell us just a little bit, Keziah, kind of to wrap up our conversation today? What are tips, just to bring hope and some light to this? What are some tips for women and children about getting through or relieving stress of the pandemic, either that they could do individually or maybe together as a family unit?
Yes. I think the one thing that I always offer is just being calm and proactive, sticking to your new routine, and being and holding each other accountable to what you built together as a family. So new routine, a new structure, being able to come together as a family unit, doing things together, sitting at the dining room table together, bringing those things that most families have gotten away from. Kids are able to eat in their room and eat in this room. No, we're coming together and let's talk about it. Let's talk about how your day was. Let's talk about, did anything happen? What bothers you? And I think that's what needs to be become the normal now, is us embracing each other, being able to also talk about emotions, right? Okay, you don't have to feel bad that you feel this way or that you're still in this stuck place. And around that table, building fun activities, doing vision boards with your families, I believe is very beautiful. Even if it's taking little trips, just driving, sightseeing, especially if the fear of if COVID is something, but just getting in the car together, driving, taking pictures, and just being in the moment, driving to a lake and just being able to sit there and see that scenery, you know, and being thankful and grateful that we're still here. We made it, we survived, right? And like Kaitlyn said, we're thriving now. And so yeah, I would say that. And then I would also leave this: when push come to shove, seek mental health services. Find somebody that will hold you accountable, having an accountability partner. Hey, Keziah, I didn't hear from you today. Normally I see you post. Is everything okay? You know, and just finding somebody that will hold you up when times get rough and being able to have that support. So that's what I would offer.
Awesome. Well, ladies, this has been incredibly insightful. Wow, I'm so thankful for the work that you are both doing to lead individuals out of dark places that they may be experiencing now and into the future, and you know, in their past. It must be rewarding to be able to help people the way you do, and I'm very appreciative of that work that the two of you are doing. So proud to have you both be Women of Achievement for us 2022, and all of the other mental health professionals in this community and everywhere. It's not an easy job. It's not one that I would ever be able to do or would want to sign up for. And I've had the pleasure of working with a lot of people that are really good at doing this work, and appreciate them so much. So thank you both for the conversation today. This ends this particular conversation of Project Table Talk. I'm really looking forward to our subsequent conversations in March and April, where we're going to also delve into mental health topics. In March, we're going to look at healing trauma after sexual assault as we lead into April as Sexual Assault Awareness Month. And then in April, we are going to talk about stigma associated with mental health in general, which is really why we at the Women's Fund chose to bring this forward as our theme for our event, because for too long, women have carried this in silence, right? We already talked at the top of the show about how women carry things until they break. Well, that's ridiculous. We need to start normalizing this, and it starts right here with conversations like this. So thank you very much. Before we have those conversations, we will also welcome the next conversation on March 10th, 1 o'clock, where we'll be joined by several women from C.D. Smith to talk about their work during National Women in Construction Week. So it's a look at leadership development, which is also one of the pillars supporting our mission at the Fond du Lac Area Women's Fund to facilitate bold change for Fond du Lac area women and girls. So see you all soon. Thank you.
Thank you.